Female genital mutilations is mostly carried out on young girls between infancy and adolescence and occasionally on adult women. 3 million girls in Africa are at risk of undergoing FGM every year. It has serious implications for the physical, psychological, sexual and reproductive health of females. I spoke with Judy Gitau in Kenya. She is Regional Coordinator of Equality Now, a non-governmental organization to advocate for the protection and promotion of human rights of women and girls. She explains the FGM situation in Africa.
The situation with FGM, if I may start with Africa, is on the legal position. There are at least 4 countries that have a high prevalence of FGM that still do not have a legal framework in place, which means FGM in those countries is going on without any form of accountability. On the positive, however, other countries that have FGM have at least a law in place. And this means even though the numbers or the prevalence is still fairly high, there's still an opportunity for accountability. With regards to Kenya specifically, some good news. The recent data health survey have indicated that the numbers have gone down from 21% to 15% this year, but there's still high prevalence in some practicing community. Now, I would say the efforts haven't been homogeneous. It depends from country to country. At the African Union level, we do have the Salima Initiative, which again seeks to accelerate the different efforts that, one, get a legal framework in place for all the countries that actually have a high prevalence rate of FGM within them, so that at least there's a basis or the policy to start from. And then the responsibility lies on each of the countries, on each of the governments to begin to push to implement the laws, but also to sensitize the communities in acknowledging that FGM is a social problem, a social norm, and therefore a need, again, to get the communities to understand in order to abandon this practice. But we also have to acknowledge in certain countries there's been a pullback. There's indeed both physical and psychological effects ranging from trauma to depression to anxiety, and we support them, including with our partners with psychosocial support, provide counseling, trauma counseling, in order for the victims to be able to accept the situation and then seek physical help if that is available. What is important, however, is that we ensure that we don't just have it in law, but we win hearts and minds, that everybody in the community begins to understand that this is a practice that results in harm,